Johnson. I'll be working with you today. I'm your nurse. My name is Renee. I'm just gonna, can you tell me your name and your date of birth? Okay, and check your bracelet. Yes. Can you tell me what day of the week it is? Okay, and who's our president? Okay. Right now, I'm checking the LOC and making sure the patient is oriented to ×2 at least. And when I'm walking into the room, I'm already looking at the patient. I'm looking at the skin color. I'm checking cap refill. Make sure it's less than 3 seconds. I'm also assessing for any clubbing of the nails, which is a long-term effect of lack of oxygen. I'm checking the patient's posture. Is the patient leaning forward in such cases as like COPD? I would also, if the patient is wearing clothes, I would ask the patient to remove his or her top so I can make sure that when I'm looking at the skin, I'm looking at the bare chest. I'm going to look at the trachea, make sure the trachea is midline. Along with the thorax, I'm observing the symmetry. Is it equal, or is one side more flat than the other? While I'm looking and talking with the patient, I'll be counting respirations in my head. You don't want to let the patient know that you're counting the respirations because it may affect their count. So you count your respirations. A normal adult respiration range would be 12 to 20 breaths per minute. Anything below, not good. Anything above 20 is considered tachypnic. So make sure you inspect that. Also, you want to compare inspiration versus expiration to make sure that they're equal.
Go.
Also, while you're at the bedside and you're observing the respirations, you're counting, you're viewing the chest, the ribs for retractions, you're going to look at the thorax for the symmetry. Also pay attention to the patient's posterior side. You can ask them to lay on their side. And you would observe for any spinal curvature problems such as scoliosis, which may affect breathing. Also, if they are obese or pregnant, that increases abdominal pressure, which may also affect breathing. And if the patient is on any oxygen, whether it's nasal cannula or vent, just make sure you look at either the liters of oxygen that the patient is receiving, or you can look at the vent settings to make sure you take note of that. After you observe everything, my next step would be to palpate. And the reason why we're palpating the thorax is to assess for any bony defects or masses. Also, they can tell you if it hurts them. Is it tender? So you want to start on your left side. You just slowly palpate. Go to your right side. You want to go down, over back to the left side, and you're making sure you assess all the lobes of the lungs, taking note that there is 3 lobes in the right lung, and 2 lobes in the left lung because of the space for the heart. All right, Mr. Johnson. Next, I'm just going to lightly tap on your chest, and this is called percussion, and I'm just assessing for tone. I want the tone to be low-pitched and hollow, otherwise known as resonance. In the same fashion, start on the left side, and you're assessing the left lung, and you just tap. Can you please roll on your side, Mr. Johnson? Okay, you can roll back on your back. And now that I've palpated and percussed the lung fields, just make sure if it is a woman to obviously take the breasts into account and move them if necessary in order to assess your patient properly. Okay, Mr. Johnson, just going to take a listen. You can continue your normal breathing. First thing I'm going to listen to is the heart and the apical pulse. Right now I'm listening to above the clavicles on each side bilaterally. And then below the clavicles on each side. Okay, Mr. Johnson, do you mind sitting up for me? Mr. Johnson's going to be sitting up. We're going to ask Mr. Johnson to remove his jacket, or you can pull it down. Again, you can assess for the spinal curvature, and we've already palpated and percussed the posterior side as well as the anterior side. And now, Mr. Johnson, can you please cross your arms in front of your chest? Due to him being a mannequin, I will continue this assessment even though this mannequin's arms is not able to be crossed in a real patient. Hopefully they would be able to cross their arms in front of the chest. When they do that, look at the scapula. Observe their shoulders. And then, last but not least, make sure you listen to the posterior breath sounds. Starting at the top, working my way to the left, down on the left, to the right, down on the right, back to the left. Okay, Mr. Johnson, I'm going to put your jacket back on.